But we have not seen an urgent enough escalation in testing, isolation, and contact tracing, which is the backbone of the response. Social distancing measures can help to reduce transmission and enable health systems to cope. Hand washing and coughing into your elbow can reduce the risk for yourself and others. But on their own, they're not enough to extinguish this epidemic. It's the combination that makes the difference. As I keep saying, all countries must take a comprehensive approach. But the most effective way to prevent infections and save lives is breaking the chains of transmission. And to do that, you must test and isolate. You cannot fight a fire blindfolded, and we cannot stop this pandemic if we don't know who is infected. Once again, our key message is test, test, test. This is a serious disease. Although the evidence we have suggested that those over 60 are at highest risk, young people, including children, have died. WHO has issued new clinical guidance with specific details on how to care for children, older people, and pregnant women.
There's no doubt that we are missing cases. I think we need to be realistic about this. The reason that we are so aggressive in our statements about finding all cases and testing cases is because we need to know where this virus is. But it is possible that we are missing cases that are on the more mild end of the spectrum. That's normal in an outbreak. It's normal for a respiratory disease, especially because certainly in the beginning of outbreaks, you're focusing on people who seek care. And so that's where people will show up, and they have a higher likelihood of actually being tested for COVID-19 or for any emerging pathogen. So it is certainly possible, and it's highly likely that we're missing cases. What's important is that there are measures, there are processes in place that countries can take to find those cases. And it's important that we don't give up. And we move to a measure to say we're just going to let this happen and we're going to see, hope for the best. Absolutely, we need to be finding all of these cases so that we can effectively isolate them and thus reduce the chances of onward transmission. Is that children are susceptible to infection and that children can be infected with this virus. They seem to be infected in terms of symptomatic infection, in terms of detection through reporting systems at a lower rate than adults. And which is different to what we would see with influenza. And from the evidence that we are seeing, we're not seeing transmission in settings like schools, where we would worry about amplification of transmission. In many countries, schools have closed, and so that is an important thing to take into consideration. We do know that children tend to have more mild infection, have more mild disease, but we have seen children die from this infection. So we can't say universally that it's mild in children. So it is important that we protect children as a vulnerable population.